Hi, Dr. Ellis. This is Yaz. Thank you so much for joining us to share your experience and knowledge of your chosen specialty. Could you please tell us a bit about yourself?
Yeah, I'm a consultant neurologist in North Staffordshire. I've been a consultant now for more than a quarter of a century, and I'm still enjoying it, so can't be too bad.
Fantastic. And may I ask, what role do you hold? Are you just working at the hospital, or do you do anything alongside?
So I work, my main hospital is University Hospital of North Midlands, but I also work at Leighton Hospital, Robert Jones and Agnes Hunt, and then what used to be Stafford Hospital, now called County Hospital. So I have a number of different clinics, and I do some private work as well.
Okay, so could you please tell us a bit about your specialty? What does it involve to be a neurologist?
So neurology is largely interested in the brain and spinal cord, central nervous system, and also the peripheral nervous system. We also deal a bit with muscle disease, but mostly it's central nervous system. And the sorts of conditions we see routinely would be headache, multiple sclerosis, Parkinson's disease, epilepsy. And then there's quite a big chunk of our practice where the diagnosis is less certain, and there are a large number of rare conditions that fall into neurological practice. Most of the time you spend in outpatients, but we have basically an acute take as well at my hospital. So once every 7 weeks, I'm the consultant on call for the week, which means spending most of the time on the wards, seeing patients, working with the junior team, which is a lot of fun. And then I do some teaching as well. So it's a varied experience.
Okay, so as part of being a neurologist, it means being on the ward and also run clinics and being on take and also do some teaching alongside.
Yeah.
Okay.
Most of the time is spent in clinic though.
Okay, mostly in the clinic.
In clinic, yeah.
Okay, and so in your personal experience and opinion, what do you think are the benefits to this specialty? Why people should choose neurology as a career?
Well, I find it very interesting, so I find it fascinating. It's varied, so it's not just one thing, because there's a variety of things to keep you interested. It's a medical specialty, so I think when you're deciding a career, there's a sort of divide to be made between, are you interested in medical specialties or surgical specialties, and are you a sort of hands-on type person, or you're more, I would say, cerebral person who likes thinking. Oh, you've got to like people. So, you know, if you're going to spend most of your time in clinic face-to-face with patients, it is a real help to actually like people. Otherwise, you're going to find yourself, unless you have some intrinsic connection with people, you're going to find it hard, actually. So that's a lot of the advantages of the specialty.
Okay, so apart from patient interaction, like if you could point out like 2 or 3 positive points of being a neurologist, what could it be?
It's very evidence-based, so you spend a lot of time looking at the literature. Google Scholar's my best friend. So, you know, several times a week I will be looking at the literature, so it's quite academic, and there is the advantage that you can be flexible in your workload. So I happen to have a very heavy workload, but other people at different times in their life with different family commitments might be ending up doing less in the way of the number of clinics than I do. And you could, you know, if you've got family life to cope with as you go through life, you could do that with a neurology specialty. And certainly some people go through training, doing part-time training, and that works well. It takes longer, but it works well.
Okay, so in terms of job opportunities, as you said, it could be in a clinic. You can be on the ward. You can do some academia alongside, and you can do some teaching.
Yeah.
Right? Okay, and job flexibility is there as well, based on how you prefer to work.
Yeah, and I think there are opportunities throughout the country. There are, you know, the hospitals looking for a consultant neurologist. So it's, of course, when you're making a career decision, You make the decision at a time when you don't know what the job opportunities are going to be like by the time you finish your training. So one can't guarantee that there's still going to be lots of jobs available in 5-10 years' time.
Okay, all right. So we have heard about the benefits of being a neurologist. So in your opinion, what would be the drawbacks that people should be aware of before choosing this specialty?
So the training itself is fairly arduous. You're going to be on call. You're going to be working hard. You can't get around the fact you're going to have to put a lot of hours in the training process. It's going to be intellectually demanding. So it's not an easy option if you want a quiet life. But I don't think anybody goes into medicine really wanting a quiet life anyway. So
that's correct. That's correct. In terms of personality traits and what sort of people, you did mention that you need to have you need to like people. What else do you need to have in you as a person and as a doctor to be able to choose and succeed in this specialty?
You have to be intellectually curious, and you have to be fairly cerebral, because there are quite a large number of relatively rare conditions that you need to know about. So there is the intellectual aspect of being a neurologist, and be able to analyze the patient presenting with multiple symptoms, trying to sort out. The diagnostic process is often complex and takes a while. But in the end, a lot of the quality of your care will be down to your interaction with the patients and how you get on with them, and how you're able to mix with people from all walks of life. And I think empathy is very important. You do need to be empathetic. Otherwise, you're not going to be able to serve your patients properly, but also you're not going to get a proper history of the patient if they don't think that you're on their side, that you're going to treat what they're saying seriously. A lot of the times, neurological symptoms to the patient sound like crazy things. And paradoxically, the more crazy the neurological symptom, the more likely it's going to be an organic pathology. So you have to be able to allow patients to explain to you what their problem is.
Okay. And in terms of the training pathway, do you know how the training happens now, or has things changed since you have done your training?
Oh, it's changed a lot since I did my training. But it's a basic medical training. So you first of all have to get your membership of the Royal College of Physicians, and they're making, I'm not sure it's such a great idea, they're making our registrars do acute medical tape now as well, because they've already got membership by the time they're getting into the registrar grade. So it's a basic medical training first, and then you specialise in neurology, and that takes 4 or 5 years. I think 5 years, and during that time there's an opportunity of taking time out to do research, so you can go out of training time to do research. That used to be more or less everybody did that. That's getting to be less now. And then you qualify. Then there's an exit examination. You're qualified as a consultant neurologist. But most of us will then subspecialise beyond that. Will carry on developing particular areas of interest.
Okay, could you please tell us a bit more about this subspecialties? What, because it's very interesting, like what are the options at the moment? I know things might change in the next 5 years, 10 years, but yeah, what are the interesting ones in your opinion?
So MS has subspecialized, the disease modifying drugs that have specialist clinics for MS. While most neurologists will diagnose MS, the ongoing management will be usually done by a specialist group of neurologists. Movement disorders like Parkinson's disease is another subspecialty. Epilepsy is again another. All consultant neurologists will be able to manage epilepsy, but some people specialize particularly in epilepsy, particularly the more high-end stuff such as epilepsy surgery. And I think those are, and some specialize in cerebrovascular disease, and that there's a bit of overlap with the stroke doctors in that area. So there are quite a number of different areas you can specialize in.
So it will never be boring then. We can always decide what to do.
Well, there are some there is at least one neurologist who changes the specialty every 10 years or so to keep themselves interested. But I think most people like a bit of a mixture of both specialist work and also more generalist work.
Okay, all right. So I'll come to my final question. So if you were a medical student or a junior doctor again, would you say you would do the same career pathway, or would you just go for different?
Absolutely. Yeah, absolutely. I've always been interested in the brain. I think the brain is the most exciting place on earth. And so that really, then you've got a choice really. Well, you could become a neurosurgeon, but that takes a special type of person. You could do psychiatry, or you're going to do neurology. And I find neurology fascinating because of the breadth of different things that can go wrong, basically.
That's fantastic. Do you have any advice for us, for everyone, for medical students and us, juniors?
So before making, it's a serious decision to decide which specialty you're going to go into. I would get some experience of it. And the other thing, if you possibly can do, spend some time with a consultant, because the experience of the specialty is different from when you're a junior on the wards to when you're a consultant. Because, for example, I spend most of my time in clinic. So you'd have to sit in with me and see what I have to do day in, day out to be able to make that decision. Can I put up with this for 30 years? That's the question you've got to ask yourself. And it's different from the junior doctor experience.
Fantastic. Thank you so much for sharing your experience and your views on pros and cons of this specialty. I really hope people benefit from this, and I'm sure they will. So thank you so much from all of us. Thank you.
Pleasure.
Thank you.